Well, good morning, everybody, and welcome to the next webinar in the Florence Nightingale Foundation series. We are absolutely thrilled to welcome Marie Kilduff, who will be our host today, and we're running events. And we have a panel of our fantastic scholars with us this morning to share their experiences of how they've led through really challenging times through the pandemic. I think it's fair to say it's been a tough 26 months for all of us, particularly in healthcare. And Marie came up with the wonderful idea of bringing people together to share those reflections and experiences today. So we're really thrilled to have a wonderful array of Florence Nightingale scholars to share their experiences from across all 5 countries, which is quite incredible to give that context. So I'm going to welcome the panelists and hand across to Marie. Just before I do that, just to make you aware, we will be recording today's webinar. So if your colleagues can't make it along, if you wanted to share with your teams, you'll be able to do so, and we'll message the email link out to you, the link to access it via our YouTube channel after today. Unfortunately, because we've got such a packed agenda, there won't be time for questions. But if you have any questions, please feel free to email us at the Academy, and we can forward your questions to the right panelists to answer for you, and obviously you can share those more broadly too. So without further ado, I'm going to introduce our wonderful hosts and panelists. First and foremost is Marie Kilduff. Now, Marie is one of our scholars and is the director of the National Clinical Leadership Centre for Nursing Midwifery, Health Service Executive in Ireland. It's wonderful, Marie, that you'll be able to join us today, and thank you so much for going to host the webinar. We also have Heather Vickers, who is a clinical research nurse manager for oncology. Hi, Heather, welcome. So wonderful to welcome you today. And Heather joins us from Scotland. She works at the Edinburgh Cancer Centre, so thank you so much for joining us. We also have Howard Pescot, who's Associate Director of Quality and Safety in Sussex, so he's our English representative at the NHS Sussex Community NHS Foundation Trust, so welcome, Howard. And next we have Heather Finlay, who's the Head of Health and Social Care at the Clinical Education Centre, that's in Northern Ireland, so joining us from our Northern Ireland counterparts, so wonderful to welcome you, Heather. Next we have Mary Brosnan, who is from Southern Ireland, so our Southern Irish representative. Welcome, Mary, we're so pleased to welcome you today. And she's the Director of Midwifery and Nursing at the National Maternity Hospital in Dublin. And last but not least is Becky Thomas, who is our Senior Nurse Improvement representing NHS Wales. So welcome, what a fantastic array of talent sharing your experiences this morning. I'm going to hand across to Marie. Thank you very much.
Thank you very much, Lucy, and I'm delighted to be here today to host this important webinar, and I'd like to welcome all our panelists and those of you that are listening from the 5 countries. I just want to give a little bit of background to this webinar series. This webinar series began in September 2020 in Southern Ireland, when my own team and myself really felt that it was really important to provide an opportunity for nurses and midwives of all grades and all disciplines of nursing to share their experience and showcase the significant clinical leadership that they had demonstrated during the pandemic. So we began the series in September 2020, and it was supported by colleagues in the Chief Nursing Office in Ireland and also by colleagues in the Royal College of Surgeons. And in terms of the series, there was 9 webinars in it, and every second week we presented these webinars, and each time was dedicated to a discipline in nursing, and then we had one for midwifery. Our first webinar in September 2020 and our last webinar in March 2022, we had our senior leaders, Rachel Kenna, who's our Chief Nursing Officer, and we had Dr. Geraldine Shaw, who's the Director of the Office of Nursing and Midwifery Services in Ireland. And it was wonderful to hear them speak about their strategic leadership during the pandemic, particularly in the early months, and then when we heard them 18 months later to hear how they'd learned so much during that time and how they had led. As a current senior at Florence Nightingale's senior scholar, I'm absolutely delighted, and I'm really grateful to Lucy and to the team in the FNF for affording me with the opportunity to scale up the initiative to really provide an opportunity for our senior scholars in terms of the current and past to present today on the webinar series, which is entitled, and this one is going to be Nursing and Midwifery, Clinical Leadership During COVID-19, Sharing the Learning from our Florence Nightingale Scholars. And they're actually from the 5 countries in the UK and Northern and Southern Ireland, as Lucy said. So without further ado, I'm delighted to introduce our first panelist. And our first panelist today is Heather Vickers, and she is a clinical research nurse manager for oncology in Edinburgh. You're extremely welcome, Heather. And I'd like you to tell us a little bit about your roles, because I know you were redeployed from November last year to April this year as a lead of chemotherapy services in Scotland. So I know you're going to give us a little bit of information on that and your current role.
Yep, so I'm the clinical research nurse manager for oncology. So I'm actually based at the Edinburgh Cancer Centre, but I actually look after and lead our 5 regional sites, which we call our sort of South East Scottish Cancer Research Network. 3 parts of my role currently are that I ensure and I evaluate the safety and delivery of the clinical research that we provide. I ensure the equity and access to clinical trials across the region, and have to liaise quite heavily with all of our partners in delivering that, but with medical teams, pharmacy, supportive departments, to ensure that I can achieve that from a sort of bigger perspective than just delivering the treatments on the ground floor. From November 2021 to April 2022, it wasn't a redeployment actually. What I got was an extra part to my job. So they managed to give me the 2 chemotherapy day treatment centres to manage, in addition to looking after my research teams, because we were trying to look at how the management structure could be improved over the winter periods where we have the difficulties, obviously. So I had to lead the 2 different chemotherapy day centre units across NHS Lothian, and I had to try to ensure that patients were scheduled for treatments with no breaches to their start dates, to ensure the regular safety standards and the safety standards that were being implemented through the COVID-19 regulations and guidelines that were being given to us on a daily basis. I had to ensure that all staff were informed, supported, were working together for the common goal, which was to provide and make sure that cancer patients did not have to stop their treatment. So for that, for my part, there was strong leadership, strong communication, and with a looming unpredictable situation occurring in front of us.
Heather, thank you. My apologies. So you weren't redeployed, you had the 2 roles going on, which was really a very challenging. Heather, I know when we spoke, there was a vast difference between your experience of leading in the first year and the second year of the pandemic. So it would be interesting for our listeners to hear, first of all, the first year of your experience, please.
Yeah, so cancer services as a whole actually changed significantly in that first year, because everything was discussed at a management level. There was very difficult ethical and moral decisions being made for patients. A lot of treatments were suspended, and if you've ever known anybody with cancer, their treatment is their lifeline. They get extremely upset and you know, distressed about not having treatments for their cancer. Some of the treatments that we had, we extended. For example, we make a 4-weekly treatment, an 8-weekly treatment. So we were starting to extend a lot of the treatments to try and relieve the burden on the patient and the hospital. And actually some patients had their treatments stopped completely for their own safety. The environment changed dramatically. We had 2-meter distances between our chairs, so we lost half of our chair availability to be able to treat patients. Therefore, our capacity went down quite dramatically. Obviously, we were in PPE every day. That had a huge impact over the summer. We were taking people's temperatures at the front door, which meant we had to staff that area. So there was lots of different things changing continually for us. And we were awaiting daily news from Wuhan. Our oncologists were in touch with the people in China to make sure to look at what cancer outcomes were happening to their patients. If you were on anti-cancer therapy, was your outcomes worse? You know, what were cancer patients faring worse than patients who didn't have cancer when they had the virus? So we were waiting for that information to come out daily from Wuhan. From a research perspective, all research across the region was stopped, everything, all disease types. Cancer was slightly different because we had to treat patients that were already in trials who were having life-saving treatment. So we didn't stop that. So our nurses were still delivering care to cancer patients. And there was a concern for me that my nurses would be sent, because all the research nurses were redeployed towards an ITU, etc. But the interesting thing was, as things shut down nationally, globally, and everywhere else, we did not have to move. The research nurses appeared to be quite safe. There wasn't any urgency to us being moved anywhere. So that was quite surprising for us in that first year.
Heather, thank you. And just in terms of the second year, because it sounds like the first year there was so much uncertainty, but the second year brought its different challenges.
Mm-hmm. So like you've already said, from autumn to spring, so autumn last year to spring this year has been a completely different experience. I think, like for everybody in the NHS, the pinch point has been those months over the winter into the spring. And what we observed in cancer was that our referrals had increased dramatically. They all came, one after the other. We were trying to deal with the amount of referrals with less capacity. And we noticed that a lot of our patients were more advanced in their cancer journey than they had been previously on presentation. We still had the environmental factors which were having an impact on us. And the main thing was that staff shortages started to really hit us at that point. So not only was it nursing staff shortages, we had pharmacy staff shortages, medics, supportive services, CT scanning. So actually the impact on cancer patients for us was massive. The thing about chemotherapy and delivering those types of treatments is that you have to be quite skilled as a nurse. So to send those nurses elsewhere was a risk factor for us, and that we had to try and maintain the sort of skill set within that group of patients. But the hospital was so desperate, and the different cancer units were staffing, that staff were having to be moved when at all possible, as long as our own patients were safely treated. Research was slightly different because through the research and development teams and all the clinical trial offices, we started opening research right back up again across the board, but cancer was really quick. And the Edinburgh Cancer Centre, through a partnership with our R&D department and all of our supportive services, we were one of the quickest centres to open all of our studies up again and actually started to take on new studies. And that's in the whole of the UK. So that's something that we are really proud of. Communication is obviously key in that time, but the main problem I had in those months was the conflict I had with the two different roles, because the wards were really struggling and research was ramping up, and I didn't have enough staff in my research to ramp up without actually giving staff to the wards. So on a daily basis, we had to give chemotherapy competent delivery research nurses to the wards, about 1 to 3 of my team a day, over the winter periods, over those months. And that was really challenging, I think, for all of us.
Heather, just listening to you there as an oncology nurse myself, I think it's admirable in terms of how you all led and managed during these really challenging times, because it's so difficult anyway for having cancer, but in your response was absolutely fantastic. And I'm just interested to know, with your Florence Nightingale scholarship program, because you started that in the middle of this last year, how has that helped you in your leadership?
The Florence Nightingale scholarship is phenomenal anyway. It's an incredible thing to do. And, I can't, sing the praises of it enough to all of my colleagues, mainly because of the community that it brings to you from people all over the country. And you start to speak to people that are like-minded and people that are interested. You start networking, you start sharing things, and the community spirit within our group. And Becky's one of my group anyway, in the emerging leaders, and she's been an amazing leader in our particular group. And as we've gone through doing particular courses with the scholarship, it's brought out so many things about learning about yourself and your skill set that you have, the behaviour that you have, as not just as a leader but as a person. And actually, as a result of all of that, what that does is it increases your confidence. So through this kind of unprecedented situation, the things that I have learned from last April to now would have been different had I not done Florence, and allowing me to think more as a leader and not just a manager or a firefighter, but actually how can I make this better? And then I have people to ask from different places to get some information and some experience that other people have had as well, and that's been completely invaluable.
Heather, thank you so much for presenting today and for sharing your experience. And I think you've represented Scotland really well as well.
Thank you.
So I'm now going to move to our next panellist, who is Howard Pescot. And we actually met ourselves back in November at RADA, so it was lovely to meet with you, Howard, and to reconnect today. So Howard, just in terms of your own role as Associate Director of Quality and Safety in Sussex, how would you say could you provide a brief overview of that role firstly, please?
Yeah, no, of course. Thanks, Marin. It's an absolute pleasure to be here with everyone today. So the role that I have, I'm a nurse and health visitor by background. I went into public health for a bit, and a little bit in commissioning, and now work in the community trust. And the role very much has that oversight of quality and safety at a trust level. So I work and report to the chief nurse here in Sussex Community. And we're about really celebrating and supporting staff around the amazing things that people do every single day and really learning for improvement. So we have that function, which is about assurance, quality, all the work we do with CQC and with regulators and the CCG, etc. We do that role, but our key function is about really looking at, learning from events that have happened and how we support. And quality and safety here in Sussex community includes, we have safeguarding, so I have the safeguarding team. We've got health and safety, so the environment factors, patient safety, so all the patient safety specialist roles, and then patient experience. So the normal complaints, PALs, patient engagement function, and also the Freedom Speak Up Guardian sits here. So for me, that gives us a really rounded and holistic view of patient and staff safety. We very much there work alongside our clinical and operational managers.
It's quite a broad brief, Howard. And I suppose in that role over the last 2 years, I've no doubt you've had your challenges, as you would have been really involved with the response. Could you talk us through some of those challenges, please?
Yeah, no, thank you. So right at the beginning of the pandemic, we were really conscious that what we needed to do was to support the function of monitoring safety. So really being aware that, we needed to have that oversight for the organisation. At the same time, we didn't want that to be a burden. So very much my mantra was that we were going to be safer. So going back to some of the old sort of sexual health days of thinking about safe and safer, we were going to be as safe as we could be. And recognising that we were having to be sort of pragmatic. I'm quite a pragmatic person anyway when it comes to project management and monitoring safety, but really ramp that up. So we spent a lot of time looking at what were the key things that we needed to do to make sure we were safer? What were the areas that we were going to let go of? And to start with, the national guidance didn't come out. So we were like, oh, what is it that we can, loosen a little bit? Then more national guidance came out. So the quality account was paused, yippies, that was great. But we very much were looking at what were the clinical audits that we needed to do? How, what was the focus that we wanted, but also releasing some of the skills and capacity as well that we had within the team and doing more of. So that was a real challenge because I was quite new in role. Our CQC inspection was cancelled the day before it was due to come in because of COVID. So we were on off about having a CQC inspection. And middle of March, it was then cancelled the day before. So all that build up around getting the organisation and then everyone ready for CQC. And then it was like that switched, obviously, then in terms of responding. So that was a real challenge about keeping that momentum. Still people, seeing the importance of safety within the organisation at a time and that more reactive emergency response that there was right at the beginning. So we really focused that challenge about, let's focus on what we needed to, let's be a support for clinical services and operational, and that really helped, I think.
And what I'm really hearing, Howard, is the adaptive leadership that you demonstrated during that time and a common sense approach, which is really what was required in the pandemic. Howard, I'm sure amidst all the challenges, or opportunities emerged and learning that you can carry into the future. So could you tell us a little bit about those? Yeah,
no, thanks. So I think as I alluded to earlier about that pragmatic approach, obviously, so we've had the National Patient Safety Strategy has come out, which again is focusing more on a safety 2 culture. Let's look at, what we're doing well and let's do that more. So looking at that more positive, appreciative inquiry approach. And I think COVID has helped us to move that forward about saying, actually, well, do we need to be doing this audit? Is this critical? What is this a risk? Or are we just doing an audit because we've had it on the audit plan for 10 years and it's something we do every year? But why? So I think we've been able to take more, as you described, more that pragmatic and releasing sort of capacity by releasing that time. What we've done as well is sort of being open to change quicker, I think. So that adaptive leadership is certainly an opportunity, I think, that's come out from COVID. So lots of people have got really good ideas, and that is every single person in an organisation. It doesn't matter what the grade is, what the professional background, every single person has an idea. So what we have now in the trust is an ideas forum where people can just put in what their idea is, and then we'll look at that and work around it. And that anyone can submit something. So it's being reactive in a way that's responsive, responding to what people are saying, what people are suggesting, and being able to then quickly galvanize that and then make that change. And for me, I think that's what COVID, even though there was a lot of the top down at times, that command and control structure, which there needed to be in a pandemic, but there was also, I think we were also released as well from actually saying, well, as you say, that pragmatic, let's just try it and let's see what happens.
I mean, I love the idea of including everybody, regardless of who they are, because everyone has ideas. And if we draw on those ideas, we can be so innovative, and we've really seen that. So Howard, thank you. I'm going to ask you the same question that I'm going to ask all the panelists, because we're really interested to hear, how has your scholarship experience helped you during this time?
Thank you. So I think for me, working within a corporate role, obviously I work very closely with the other corporate nurses that report to the chief nurse and our area nurses and therapists. But for me in this role, what it's meant is I've been able to link in with other people who are in similar roles as well across the organisation. And as Heather was describing, in terms of that sense of community, I think that's something that we all felt we lost during COVID at times. And what Florence did was sort of give that back, giving us back that community and that connection and a space where we could have those conversations. And I think in hearing as well that we're all leaders and we're all on a journey. We all experience the imposter syndrome, maybe every day. That's okay, and that's all right. We are human. And I think for Florence, that really helped me grow in terms of my confidence to say, actually, everybody else is learning. We're all on this journey in life, but also within our leadership. So for me, it's helped me develop that really sense of what my voice is, and that my voice is valued, and people want to listen to my voice. I want to hear and listen to other people as we are here today. And it's a disservice for me expecting those people would not want to hear my voice. You are all amazing people here on the panel and people who have joined us. And why would you not want to hear my voice? Give you that opportunity. So for me, that's been really important about reclaiming some of my own self-worth and also about having that voice again.
Howard, thank you so much. I think your authenticity has come true, and it's lovely to hear it, because I think we all feel like that. And we all feel the imposter syndrome. So it's just really good to be able to do that. And thank you. And we certainly will want to hear your voice again. So thank you for representing the English, for being the English representative today. Thank you.
Thank you for asking me.
I'm going to move on to our next panelist now, and I'm delighted to introduce Mary Brosnan, who's our Director of Nursing and Midwifery and a very good colleague of mine and the Leadership Centres. And Mary is from, as Lucy said, the National Maternity Hospital in Holles Street, Dublin. Mary, you're really, really welcome to the panel today.
Thanks very much, Marie. It's a pleasure to be here and an honour to be here. Thank you.
And Mary, could you tell us about how the pandemic has impacted midwifery services in Southern Ireland, please?
Yes, certainly. Like every service, it was very much about adapting very quickly in the first few days. And with maternity, obviously, babies don't wait, so we couldn't defer any of the service. And we did defer a lot of gynecology and women's health services, but we immediately had to pivot with care pathways to keep women safe and their babies, obviously, and keep staff safe. So I suppose looking back, it's 26 months, I think Lucy said. It seems like a lifetime in certain respects, because I suppose remembering back to the times we were really fearful of not having enough PPE. I remember we were down to 100 masks in the hospital on one particular day. We were locking them away. We were trying to make sure people didn't take one inadvertently. And it was just a crazy time when I think back on it. The whole supply chain concerns. So looking at how our staff responded firstly, and I'm working in the largest maternity hospital in Ireland. It's 8,000 births, about 430 midwives and nurses. It's a big teaching hospital also. So we're one of 4 big tertiary centres. So we obviously have a very large cohort of women who come through who are very straightforward, low risk as well. And we have a very large community midwifery service. So we had to try and decide were we going to defer or take any services away from the community and pivot them back to the hospital, but we very quickly made a decision that the community midwives should keep visiting and that we should ramp up our early transfer home service, which wasn't as necessarily in keeping with what every other hospital was doing, because some people were kind of rationalizing the number of people available. And obviously as staff started to get sick with COVID, we were under severe staffing pressures at times. But looking at what women needed, first and foremost, we decided not to limit that service. And that was a good decision in retrospect. The other main thing, I suppose, was the fact that obviously research was emerging all the time about placentitis, which was the big concern for babies and women during pregnancy and the risk of stillbirth or late miscarriage. And so in the early stages, we were saying, oh, this is just like the bird flu. It won't really impact on women too much. And then we started to see COVID placentitis coming out very clearly in the research in the second 6 months of the pandemic. So the fear and anxiety really ramped up. And I suppose that was something we were managing really carefully, was the anxiety levels of women and their partners and families, and anxiety levels for staff that they were going to come across a lot more. We started to see a lot more mid-trimester miscarriages, and we started to try and feed that into the National Centre for Research that was coming through. So I suppose it was just about the fact that this nothing was static, things were changing, and the learning was improving all the time as we went along.
Mary, I think the common theme from listening to everyone is just the uncertainty of what you were trying to deal with. And I know when we spoke recently, you mentioned a lot of other challenges, but you also explained how you overcame them. Could you talk to us about some of those?
Yeah, and I mean, it's very much as what Heather and Howard were mentioning there around managing a service that can't be deferred. I suppose the big thing is relying on the team. And for me, I think looking back, the thing I'm proudest of, and obviously COVID isn't over, we've women in today with COVID in the hospital giving birth, but the thing that struck me most was the value of pulling together as a team and how everybody just put the service before their own needs at times. And when people weren't vaccinated and were worried about coming to work, they still came to work, even though they may have vulnerable people at home. That all was what we're about, I know, but it doesn't necessarily translate all the time that would be, and it's not that we're selfless, but I suppose we have that level of professionalism across the team, not just midwives, nurses and doctors. We saw it with a lot of the support staff who came in despite all of that. The other thing, I suppose, the level and the importance of communication, I think, was really vital. And in the early days, as I say, just particularly in the first 3 months in our first lockdown that went on until the end of June 2020, we started producing a twice or 3 times weekly newsletter for staff. That was so important. I was also running alternate days, telephone meetings with my own teams across the hospital and the community. So I would just have a teleconference set up at 2:30 every second day, and people could dial in, whether they were on the ward, in their car or whatever, and just to give them an update as to what was happening. I think that was really, really very important, and certainly fed back afterwards that was really good morale booster. And the other thing we had, I'm sure in England you had lots of similar initiatives where there were Feed the Heroes type things where corporate companies were coming in with presents or food for the staff. That here in Dublin we had a lot of that, and there's some fantastic local restaurants that were feeding us every day, and we got lorry load of Easter eggs the first Easter. We got, I say everybody gained the COVID stone because we were eating ridiculous amounts of chocolate. That was just mad when I look back on it. But yeah, that was the value of open communication, the value of using virtual platforms. And I know I mentioned to you, Marie, we were one of the first hospitals here in Ireland to introduce it's called Attend Anywhere. I don't know if the NHS use it also. So we were using Attend Anywhere with an awful lot of our services, whether it was mental health or diabetes or a lot of the other bereavement services. We introduced that, and it's something that's here to stay as a support for our service.
Mary, as you're speaking there, I'm just hearing an awful lot of learning and initiatives that you might carry into the future. So as Director of Midwifery and Nursing, what would you think would be important from COVID and the learning to bring into the future for midwifery services?
They always say never waste a crisis. And I suppose for years I was thinking about trying to get our information up much more virtual and online. And I was always being told, it's not me, but I mean, we often discussed it as a team, that why can't we make more of our little QR codes for this, that, and the other? And you were always being told, oh no, women need to sit in a room and need to hear it from us directly, and no, it wouldn't work. And all of these things where we were running community services that could have been much more, I suppose, customized to online. It now works, and it doesn't replace the online world, does not replace face-to-face for everything, but there's so much more that we can use, and we are using it for now. So we have a very big catchment area. We're covering a lot of Leinster, which is, a couple of 100 miles each way from the hospital would be women coming for certain services. So we don't need them all to come to a classroom to learn how to manage a diabetic pump or to learn how to just breastfeed a baby. So much of that is now virtual, and I'm really proud of the amount of, I suppose we call it the e-learning classroom or the virtual classroom that women can now log on the website, and it's wonderful. So that to me is one of the biggest learnings. And again, Howard mentioned about the team validated for what they do. I think it's been a real validation for the midwives that they are really providing a service that has flourished in lots of ways during COVID.
Sorry, Mary, as you're talking there, I'm just thinking that it was absolutely liberating in some ways to remove some of those obstacles that stopped us from actually doing things that we knew would work, but we were always being told that they wouldn't. So it's great to hear you giving examples of that. Mary, we're really proud of the fact in Ireland, you are one of our first, well, you are actually our first Florence Nightingale midwifery scholar. And we have a network since with 12 scholars now in Ireland. So we're really proud here in Southern Ireland to introduce you always as our midwifery scholar. And you're so supportive to the Leadership Centre. But I'm sure people listening who may be considering doing the scholarship, and indeed our own panelists, would love to hear how you've actually used the learning from your scholarship back in 2017 to date.
Thanks, Marie. That's very kind of you to say that. And I suppose one of the things, like I have been in a senior role for a long time. I'm doing this job nearly 16 years. And I suppose when I applied for the scholarship in 2017, I thought to myself, am I stale and am I doing the same thing? I don't want to be just turning up and on the job retired, and I'm not ready to move out of this hospital role either, because I really love it. So this was, I suppose, stepping into the Florence role, or at least scholarship, I mean, really gave me a chance to, I suppose, own my role again and validate what I do, and to stop apologizing for, maybe we talked about the imposter syndrome, we all have it at times, but just also to maybe step into the leadership role. And I got a lot of feedback when we were doing those questionnaires and surveys in the first entry level period to the scholarship. I remember getting feedback from a colleague on the board of the hospital here, who said I needed to be a little bit more open, how did she put it, something around using my voice. And I was a bit taken aback, because I think I'm very vocal and I think I'm fairly articulate at times anyway. I tend to waffle at times too, but anyway, she said you need to step up there and articulate your opinion a bit more. And it kind of made me think a little bit about how we represent our professions. And I suppose I would have in the past maybe not necessarily seen myself as a midwifery leader, and although I know practically I am, and I'm in a very senior role, this has given me permission to be that leader. And I think it came very much for me to the fore. In recent months, we had a very big public outcry over the maternity hospital that we're trying to build here in Dublin. It's a very large co-located build on a site of an adult teaching hospital that had in the past religious ethos. And this became a very large political hot potato for the government, where they were trying to sign off the decision to move the hospital. And a lot of people felt that we were going to limit women's rights by being on a campus with a religious ethos in the past. And we were very much put out there, and myself and 2 medical colleagues were asked to take a lot of media coverage in May to talk about what it is the hospital will provide, and the fact that we are going to expand and support women's choice and rights and termination of pregnancy, gender affirming surgery, all the other things that are evolving as part of modern healthcare and maternity and women's health. So I suppose I was out there front and center with 2 medical colleagues making those points and on the media a lot. And I suppose I felt, having had that training with RADA, having had the support of my colleagues over the years, I felt well able to do that. And I think I represented the arguments well and articulately with assurance for our profession. So I was really proud to do that. And looking back, I think that's one of the things that I gained from the scholarship, really, was that self-assurance.
Mary, thank you so much for presenting today and for representing Southern Ireland and midwifery. Thank you. So I'm going to move on to our next panelist now, who is our Northern Ireland representative and a colleague from my own scholarship programme, Ms. Heather Finlay. And Heather is currently Head of Health and Social Care Clinical Education Centre in Northern Ireland. However, for the first 18 months of the pandemic, Heather was Deputy CNO in the Department of Health for Workforce Education and Regulation. So our first question to Heather, when we met and spoke before this webinar, it was very evident that there was huge experience during that first 18 months in that role. So Heather has kindly agreed to talk about that. So Heather, as you were in the Deputy CNO role for that time, could you tell us about that role and what it entails?
Thank you, Marie, and lovely to be part of the webinar today. Yes, whenever I was in the Department of Health, that was working within Northern Ireland government whenever the pandemic came. And as Deputy Chief Nursing Officer, I was a key member of the Chief Nursing Officer's team, working alongside other professional officers covering nursing, midwifery and allied health professions. My specific responsibility was the provision of professional nursing advice on all matters relating to nursing and midwifery workforce, education and regulation through the Chief Nursing Officer and on to the Minister of Health. And that professional advice involved a raft of things such as preparing ministerial briefs, providing responses to ministerial questions, giving evidence at the Committee for Health of the Northern Ireland Assembly, inputting and preparing for Assembly debates, speeches, etc. I also had a very key leadership role as DCNO and had the privilege and the ability to influence the development of policy and strategy and guidance relating to workforce and education regulation. Another key aspect of the role, of course, was stakeholder engagement and partnership working. And that started internally within the Northern Ireland Civil Service, which I was working within as a professional, but also regionally across our wider health and social care system in Northern Ireland, working with NHS trusts, NHSC organisations, etc. Also with the privilege of working nationally with colleagues across the other UK countries, linking in with the regulator on a regular basis, and also with colleagues across the Republic of Ireland and also internationally. And a key role I had was responsibility for commissioning of post-registration education in Northern Ireland for the our health and social care, nursing and midwifery workforce, and the management of the budget associated with that. And around about that time, we would have had in and around 18,000 registrants, which that budget would have covered, and that would be excluding nurses working in primary care and care homes, etc. So that's just a synopsis of the role in a nutshell.
Heather, a very, very broad role and very strategic. So I'm just going to bring you back to March 2020 when you were in that role. And in the first few months of leading, can you tell us what your key priorities were and how you managed and led on them?
Well, there are undoubtedly just the immediate challenges of an unprecedented event, which was causing underlying fear, particularly the fear of this unknown virus across society and across the professions. And of course, everyone looked to the Chief Nursing Officer across nursing and midwifery and to the department for direction. And of course, as we all know, there was no textbook to follow. But particularly from a strategic leadership perspective, there were real concerns across Northern Ireland and the rest of the UK, of course, regarding the capability and the capacity of the nursing and midwifery workforce, which was already under significant pressure and shortages, as we all know, to meet new demands for this unprecedented virus and what was coming over the hill. So real fear and looking for direction. I very much remember that. It was almost palpable. And seeking a way forward as to how we could support and how we could enhance and prepare the workforce for the challenges that lay ahead. Of course, there were also the immediate change of ways of working. The department went into business continuity mode, and the focus was all on surge planning and everything around the pandemic. There was some home working, but initially in the first phase, I remember being in the office working very long hours, day after day. But you just put the needs of the service and the strategic priorities ahead of everything. And we worked very much together as a team. We were focusing on how we could support the workforce. There was the workforce appeals that I inputted into for nursing and midwifery within the department. The trusts were looking at redeployments of nurses from one area into another, particularly our critical care and our respiratory wards. There were then urgent training needs that needed to be looked at across the system to prepare staff for this. And then, of course, there was the underlying staff health and well-being, and particularly around the fear of COVID. Was there enough PPE? And all of that we experienced, as well as Mary referred to that, in the south of Ireland, as did we in the north. In terms of education, I had a key role there, and priority was to maintain our pre-registration training across nursing and midwifery, and also post-registration education. What could we continue? Is there anything we needed to adapt and pause? And I had a key role in working alongside the Nursing and Midwifery Council, along with my UK counterparts, in discussing what emergency standards were going to be necessary. I was part of agreeing those nationally, and then the implementation of those emergency standards to support students, our universities, and of course the workforce to continue to lead and work. That involved the production of departmental guidance regarding the implementation of those emergency standards to ensure that we had regional consistency across Northern Ireland with our universities, where we commissioned education, and also the implementation of those within practice, within trusts. So that was a key role I had. As well as we had the implementation ongoing of Future Nurse, Future Midwife, NMC standards, which were preparing a new curriculum and new implementation for pre-registration standards. So there was a risk that that work could be put in jeopardy, and it was how could we continue that. But we made some adaptations, worked with the NMC to make that to continue. But there was massive adjustments, I recall, on how we communicated, got business accomplished, and how collective decisions were made across Northern Ireland and across our nursing and midwifery leadership. So those were more the immediate challenges and priorities at that time, Marie.
Heather, from listening to you, I don't know how you got home at all, actually, from the office during that time. You're so busy. But it's actually a wonderful opportunity for people who aren't working in the strategic roles to really hear what happens at that level, and to hear how much you've actually did and do to influence, in terms of, influence what happens in nursing and midwifery and health services as a whole. Heather, we have spoken and around your role and around the rest of the pandemic up until now. Can you tell me what opportunities arose and what learning you gained that you can carry into the future?
For me, certainly what really stands out in terms of learning was the importance of effective leadership and communication. Looking back, that was absolutely critical at the time to making key decisions. at a strategic level, and also providing strategic direction in a time of crisis. We had a very strong chief nursing officer, and we worked very, very closely together as a team. So I also learned about the critical importance of having those well-developed, effective working relationships as a team within the Department of Health and with the CNO, but also those effective working relationships with key stakeholders across the system. That importance of effective teamwork and being able to rely and trust your colleagues at a time of crisis. There just wasn't the time for the usual consultation, giving information in advance. Quite often it was, teleconferences, even at the very beginning, even before we started to use Zoom, bringing people together at very short notice, asking them to make decisions there and then. There just wasn't the time, and that was the working relationships that we had with those people and I had across the system were absolutely key, because you did have to trust one another. Another learning really would have been, I suppose, resourceful resilience is how I would describe it. I certainly learned about myself and resilience that I had, which I wouldn't have thought I had before, and others around me. And it was also very evident within our workforce as nurses, midwives, and the rest of the HSC staff really went the extra mile, and people kept going. But I think after the first wave, as the pandemic continued, there was that recognition that us as professional leaders, our colleagues out in clinical practice were not superheroes, and you cannot keep going on and on forever, but that we're all human, and that we became more alert to the importance of self-care, the focus on the health and well-being of our staff and ourselves primarily. And I suppose the all-important comment that our chief nursing officer said, it's okay to not be okay, and to recognise that within ourselves, and to encourage the workforce to highlight that as well. Further key learning for me was the opportunities, new ways of working, being those efficient and effective methods that we were so afraid of almost at the start, but we had to use, and now so many of them have become mainstreamed into how we do business.
Heather, thank you. As really, it's what you're saying there around self-care is so important, and the learning from your experience. But I think it's wonderful to hear a very senior person say it's okay not to be okay, and to give permission to look after ourselves, because if we don't look after ourselves, we can't look after anyone else. So that's really, really important, and a key message from what you've just said. Heather, in your current role, how can you apply the learning from the pandemic and your Florence Nightingale Foundation scholarship experience to enhance how you will lead the Health and Social Care Clinical Education Centre going forward?
Well, in my role as head of the Clinical Education Centre, I lead a regional service across Northern Ireland that provides in-service post-registration education to nurses, midwives and allied health professionals. And through a team of nursing and midwifery and AHP teachers, within CEC here, we design and deliver education that supports those professionals across Northern Ireland to deliver safe and effective care. And really, through working collaboratively with our stakeholders, we deliver a diverse range of programmes across a wide variety of fields of practice and settings to meet the learning needs of the local workforce, and ultimately to improve health outcomes for our Northern Ireland population. And the Clinical Education Centre really had to respond with an immediate agility and urgency to pandemic challenges and adopt new methods of programme delivery. It was all face-to-face learning, and literally overnight had to change to virtual and delivering education on Zoom. And we had to develop new COVID-related programmes to prepare registrants for different ways of working, PPE, IPC, and of course the COVID vaccination programme later on in the pandemic. So key learning really that I can apply from my learning in the department role is how to harness those new ways of working. And virtual learning works. Doesn't necessarily work for everything that's skills based, but it works for a lot. And we're going forward and using virtual platforms to enhance how we deliver education. And also the value of those effective regional relationships. A lot has been achieved by the team in CEC, and it's training and supporting them to continue to deliver things differently, as well as us having now a blended approach to learning, because we're also doing face-to-face and starting some simulation. The scholarship, being on it, has been invaluable, and as a senior scholar on the scholarship, it's really enhanced my leadership, particularly I suppose through the value of peer support, the widening of the connections that I have, and having a network of colleagues in similar roles facing similar challenges. I find that particularly useful. Also, being a scholar has provided opportunities to learn, listen and reflect, and have that all important time out, which is so valuable. And I've also found the experience and opportunity of having a mentor particularly useful. I don't have a mentor who's a nurse or a midwife, and that has also proved useful as well, including the learning from the RADA and how to adapt and develop yourself as a leader in those challenging situations.
Thank you so much for presenting today and for being the representative for Northern Ireland. It's been wonderful listening to you with your key messages. Thank you. And last but not least, I'd like to introduce Becky Thomas. Becky, you've been extremely patient. You're coming in as our last panelist today. So Becky Thomas is a senior nurse improvement with NHS Wales. And Becky, you know, from talking to you, your role is quite unique. So again, it would be interesting for our listeners to hear a little bit about what your role involves.
Yeah, thank you, and thank you for the invite to be here today. I'm delighted to be here and representing Cymru. It's always a good thing, isn't it? So thank you for the invite. Yeah, so I guess I've been a qualified nurse for about nearly 3 decades. Sounds more impressive than 28 years, but yeah, 3 decades. And you know, I've got experience in a wide variety of services. So, for example, I've worked in acute medicine, respiratory endocrinology, gastroenterology. And back in 2007, I think it was, I got interested in improvement because I was asked to lead on the productive ward, or at least in time to care, or transforming care is known as under many different guises. And it turns out I had a bit of a penchant for improvement and engaging with people, and it quickly became a big passion of mine. And so back in 2000, and then shortly afterwards, I ended up in a kind of a band 7 role where I was doing improvement more broadly across the organisation that I work in, which ultimately led to a point of me getting senior nurse post in 2015, which was a double portfolio. It was professional standards and quality improvement, huge portfolios, both. Ultimately they ended up being split, and I stuck with the quality improvement stuff, which basically means integral to my role is supporting multi-professional teams as they lead and develop improvements within their areas, providing them with the tools, the techniques, education, training, and the support they need really to improve the experience of our patients themselves, as the staff, the organisation, carers and service users, just generally our population. So yeah, it is different, but it's hugely enjoyable because it means I kind of span the organisation, and I'm able to sprinkle my influence everywhere, hopefully.
And Becky, I know when we spoke, it was really evident that you really use your skills, obviously, in your current role, but they were very important during your periods of redeployment in response to the pandemic. Could you tell us a little bit about that?
Yeah, so I guess as a nurse, I struggled actually for during the pandemic, because I wasn't able to be what I consider to be a proper nurse, and I wasn't able to be redeployed into a clinical area because I was on the patient shielding list. Which stopped me from being out there with my colleagues and my friends and kind of working alongside them and supporting them emotionally and things like that. But I was able to do that from a distance, I guess. But what I was able to do in conversation and some persuasion with my line manager was to support testing and vaccination, you know, in the latter sort of 6 months or so. And so I was asked to set up a testing site in one of our local in the Merthyr Cynon Valley to start with, and I used my improvement methodology to help me and the team to understand how we can make sure that we run that and we run it well. So we applied process mapping and all sorts of things. I had my flip chart out and I had my pens out, and anybody who's an improvement person will know that, you know, we love a flip chart, piece of flip chart paper and pens and post-its. So like the quintessential improvement tool, aren't they? So that was hugely beneficial for both me and the team that I was working with at the time. And then I was asked to be the clinical lead on a mass testing site, which was essentially a large car park with lots of metal porta cabins and lots of traffic being directed around. And I got to work with ex-military staff. And I never thought that I'd find myself in a high visibility vest with a builder's suntan, because I was out with a walkie-talkie. That was a really exciting part of it. But again, I was asked to continue to try and support that, the improvement stuff. And there was a team that came to me and asked, could I help them with some process mapping? I said, of course I can, but you're going to have to come to a car park and you're going to have to sit outside, and we're going to have to do it that way. And so I've got pictures of me actually where I look back and I'm kind of stood in the doorway of this metal porta cabin, flip chart paper either side of me, and then there's people sat in folding chairs. Looks like we're at a festival, but we're not. They're all in high vis vests, I'm in a high vis vest, and we're process mapping. And it worked. Thankfully it was a sunny day, but yeah, so it was really difficult, but I think it just demonstrates the transferability of skills, into wherever you find yourself, really. So yeah, it was a strange time, but a really, really great time. The camaraderie, and people just pulled together and did what was necessary. Nobody ever asked questions around why do you expect me to do that? People just did it, which I thought was just wonderful.
Yeah, we're really hearing the can-do attitude today, isn't it? And the collective
Absolutely.
leadership of coming together. Becky, we talked a lot about why you decided to do the FNF scholarship. And you also were telling me how it's really helped you to develop as a leader. And if it's okay, I think it was such an inspiring story. I think our listeners would love to hear this. So could you tell us a little bit about how you came to do the scholarship and how it's developed you?
Yes, so back in 2015, in the June, I found out that I'd got this senior nurse post, which was hugely exciting. But sadly, in October of 2015, I was diagnosed with stage 4 bowel cancer. And the following 2 years was basically a number of appointments with very poor outcomes. I had lots of surgeries, massive surgeries, lots of chemotherapy. I tolerated it fairly well, and then accumulated in, it had spread from my bowel to my liver and then potentially to my lung. And then thankfully, I never thought I'd be saying this, we actually went out and celebrated this, but thankfully the nodules that were in my lung turned out to be sarcoidosis. So I still have sarcoidosis, which is why I was on the patient shielding list, because obviously catching something like COVID would have been a bit of a problem for me potentially. So yeah, and I guess so that took me out of work for in and out of work for 2 years, and then sadly, my best friend, when I found out that I was okay in 2017, in March 2017, and then sadly my best friend in October of 2018 was diagnosed with cervical cancer, and she wasn't as lucky as me, and she didn't survive. So she passed away about a year later. Sorry, I still kind of guess a little bit. And then COVID hit, and so as you can imagine, the anxiety and my confidence was an all-time low. I had lots of self-limiting beliefs, because I'd been in and out of work and properly settled into the role. And then I heard about Florence, and Lucy knows I always joke about this. I always thought it was a bit of a twin set and pearls type of gig. I'm not a twin set and pearls kind of girl, but that couldn't be further from the truth. And a friend of mine was doing the scholarship in 2020, and I could see what it was doing for her in terms of her confidence, and I just thought, you know what, I need to do that. And even though the imposter syndrome and everything else, and that confidence kind of got in the way, so I applied, and when I got the phone call to say I'd been successful, I thought they'd rung the wrong person. So imposter syndrome was alive and kicking. And look, from the minute I found out, I walked a bit taller, I felt more confident. I don't know what it is. I've had these conversations with lots of people. It's like fairy dust, and it's instantaneous. I guess it's around the reputation. I guess it's around the huge privilege and the prestige being lucky enough to do such a scholarship, but almost immediately I started to feel more confident, and now I'm doing things and reaching out to people and asking people to engage with me, people I would never have asked with. I've had conversations with the Chief Nursing Officer of Wales. I've reached out more recently to Andrea Sutcliffe in the NMC. I'm just, there's no stopping me now. So, and it's I'm all about how I can pay it forward as well. So for those of you who may not know, I've got to use this as a shameless plug for the Leadership Log. Created a podcast to pay it forward, so all of the leadership learning that I get, I'm sharing a lot on the airwaves with others. So yeah, it's been huge, absolutely huge, life-changing.
Becky, I have to say you are so inspirational, and when we were supposed to speak for about 15 minutes, but we ended up speaking for about an hour and a half there a couple of weeks ago, and I was so impressed by your story. I was a little bit concerned about you sharing it today for your own sake, but you are so admirable, and I have to say you're also a real leader because you take every opportunity, and I love the plug for the podcast. And also, you've also roped me into doing something on the podcast in September. So look, it's been fabulous, and just to say there's huge messaging coming in from people to say that you are really inspirational. So thank you so much. I have to say though, my final question to you, I just think this is absolutely fantastic. You need to share with us how you're using your scholarship money, because it's so different and innovative.
Yeah, so I've been described as unique by many people. I'm a label I'm happy to and proudly wear, to be honest. And one of the things I was very keen on in terms of the scholarship is I didn't want to spend it on just any old leadership program. And that's not to diminish, all of the leadership programs that are on offer are fantastic, but I needed to do something that fitted with me and who I am. So I've used some of my money for coaching, which is transformational in itself. Because as you can imagine, I have lots of issues with saboteurs and those self-limiting beliefs, and that's a big part of my confidence. So coaching has been hugely beneficial from that point of view. But I pitched an idea to the lovely Lucy around becoming an accredited Lego serious play facilitator. And she made me work for it, to be fair, and quite rightly so, because I think it's something very unique, and there's probably not something I believe is not something that's you've come across previously. And so essentially I am now an accredited Lego Serious Play facilitator, and Lego Serious Play is an approach that basically supports the participants in the process of creative thinking, problem solving and shared decision making, and it's based on a structured facilitation process. And reflection plays a prominent role in it, and the triple loop learning. So it means that during the process, participants start giving meaning to values and their purpose and the question why and all those sorts of things. And fundamentally, it's based on several principles regarding leadership both personally and in organizations. And so but I've yet to do a workshop. I've yet to practice my skills, so I'm roping anybody and everybody in to kind of support me in that endeavor. So if anybody wants to do Lego Serious Play workshop, give me a shout.
You're such an opportunist, Becky. It's fabulous. So I'm sure we'll be inundated with requests. And just to say thank you so much, Becky, for representing Wales and representing the FNF scholars as well. And it's been absolutely lovely getting to know you, and we'll be keeping in touch. So that is the end of our panelists for today. And I'm absolutely so delighted with how it went. And I really feel it's just been absolutely so worth all the preparation, because we have heard such fantastic leadership from each and every one of you. And I think, Lucy, your biggest problem is, from all our listeners, you're probably going to be inundated with applications for this year's scholarship.
I hope so. I absolutely hope so. And applications do open in August. I'm going to do a seamless plug as well.
Absolutely.
It opens in August, closes in October, and we'll be running how to write a successful application for all our member organisations as well. So he'll be on this, some of them will be listening to this webinar as well. So please do apply. I'm a fellow scholar. I love the foundation so much. I've come to work with them. So it's transformational. So please do.
It certainly is. And we'd all say that, Lucy. It's a wonderful opportunity, and I would highly recommend it as well. So I'm going to hand over to Lucy now, but I'd just like to thank everybody who's been on the panel today. Thank you so much. It's been wonderful working with you, and thanks so much for inspiring presentations of your clinical experience. I'm delighted to add this to our webinar series, and I'd like to thank all of you who came in and listened to the webinar today. So I'm going to hand back over to Lucy. Thank you so much.
Marie, an enormous thank you to you for hosting and collecting these wonderful stories together. As you say, preparation is key, and it's been an absolutely fantastic webinar, very poignant and thoughtful responses from all of you. So thank you. Extend my thanks to each and every one of you. And so wonderful to be sat virtually with lots of fellow scholars as well. I just wanted to share, I've been writing notes as I go through. People who know me, I'm a prolific note taker. I can't help it, how I learn and retain information. But the key themes that I've seen coming through from today is really around the scholarship, that sense of community connection and building of confidence. I think I've heard that from all of you kind of in different ways. But what was really nice, the sharing of the learning from the pandemic. And I was on the front line as well. I was in the surgical hospital and other roles as well in director of nursing post. But it's nice to see the themes through all of your accounts is about appreciative inquiry, Howard. I think you're so right. We reviewed services like nothing before, didn't we? Quickly turning things around and really asking that why and being bold and challenging, which I think is just fantastic. The second area I think all of you touched on, using virtual platforms. You know, we use it in such a way to enhance communication and share best practice across all platforms. Like today, look, we've got people from 5 countries, experts from 5 countries sharing that learning. It's just wonderful, absolutely wonderful. Would we have been doing this 3 years ago? Probably not, probably not. And then finally, I really liked, and it was in the chat as well, it was wonderful to see all the chat and inspiration coming through, is about using your voice. And it's so important, Mary, you touched on that, using your voice. That information is power. And actually, through certain times, it's really important to keep communicating even more, because that's been a lifeline to so many. So thank you so much, all of you, for sharing your insights. Marie, for hosting. It's been incredible to work with you. And I'm looking forward to further webinars. We'll share your webinar series as well, Marie. So in our communication, we'll share the link and the recording with you all. Please do share far and wide with your colleagues. I think there's been so much to take away from today. I've thoroughly enjoyed it. And just one final comment from me, if you like to talk, is it is okay not to be okay. So make sure you all look after yourselves as well. Self-care is absolutely key. So take care, have wonderful afternoons, enjoy the sunshine where you are. And thank you all. Thanks for a wonderful webinar.
Thanks, everyone. Thanks, Lucy.
Take care.